Let's just dive into it. Most wheelchairs need what's called a home assessment, where we're just going to start with Medicare. Medicare says, in order to have a wheelchair in the home, you have to basically make sure it works in the home. Now, when doing an assessment, can this be done virtually? Can you do it over the phone, or do we need to actually go out to everyone's house to do these wheelchair assessments? What do we do?
So we actually go to the patient's house to do an assessment. That's the number one. However, as I have read, we can definitely do it virtually too. So we can do it virtually, but at the same time, we need to make sure that we are also checking in with the patients once we deliver the hospital bed. The wheelchair. I'm so sorry.
Well, hey, we're going to do a wheelchair and a hospital bed. No, but you're right. In-home assessments for wheelchairs can be done either virtually or remote. You can do it over the phone. You just have to, we have a very simple checklist. If you don't have this checklist, just let us know. If you have an Offsite team member, we'll give you our checklist that we have, and you can say, hey, this is ABC DME's checklist. To get it authorized inside the house. For us, it really varies. Our big thing with wheelchairs is we want to make sure the person's fit properly. I am an ATP, and it's hard because you can tell me someone's 5'2", 120 pounds, and I can use two completely different wheelchairs because we've all seen those patients. They're all thigh. Their upper body's nice and narrow, and they're all thigh, and you're gonna have to put them in a 20-inch wheelchair. And then there's other ones I've seen. We'll just pick on men. They're really, really skinny at the hip, and all their weight's in their belly. We could probably get them into an 18-inch wheelchair, maybe even a 16-inch wheelchair. So you got to have that assessment to figure out what wheelchair you're putting someone into. Now, most importantly, Medicare wants the in-home assessment to make sure it fits through all the doors. I've gone into a number of homes where someone is getting a power wheelchair and it does not fit. It just doesn't. It's a single wide trailer, and they're like, well, I'm only going to use it outside. That does not work with Medicare. You can always take your wheelchair, scooter, or power chair outside. All that matters, according to Medicare, is using it inside the house. And we also have, there's a lot of split level houses. Well, is it going to be used upstairs? Is it going to be used downstairs? What does that look like as well, too? And it can kind of be a quandary.